Hello AP students, this is Mrs. Politsky and I have notes for chapter 13. We are going to talk about behavior therapies. So, behavior therapy is any form of psychotherapy based on the principles of behavior learning, especially operant conditioning and classical conditioning. Behavior modification is another term used for behavior therapy, and it deals with problems like overeating, bedwetting, shyness, antisocial behavior, or anything that could be described as purely behavioral terms. Undesirable behaviors have been learned and therefore can be unlearned. Focus is on the problem, that the behaviors determine how the behavior might have been learned and how they can be eliminated and replaced by more effective patterns. Classical conditioning therapies. A while back we had talked about Mary Cover Jones. She was the first example of behavioral therapy. She came up when she was working with a small child named Peter. Peter had, for the most part, developed a very intense fear of rabbits, and so she was able to desensitize the boy's intense fear over a period of a few weeks by gradually bringing the rabbit closer and closer while the boy was eating. Eventually, Peter was able to allow the rabbit to eventually sit on his lap while he petted it. This type of therapy is also used to treat bedwetting. The method involves a fluid-sensitive pad, such as the one you see pictured below here, placed underneath the patient. When the moisture sets off an alarm, the patient would be awakened. The treatment was effective in roughly 75% of all cases, an amazing success rate in view of the dismal failure of psychodynamic therapy to prevent bedwetting by talking about the meaning of the symptoms. Systematic desensitization. A guy named Joseph Wolf, he reasoned that the development of irrational fear responses and undesirably emotionally based behaviors seem to follow the classical conditioning model. The nervous system cannot be relaxed and agitated at the same time because these two have incompatible processes that cannot be activated simultaneously. So, systematic desensitization is a behavioral therapy technique in which anxiety is extinguished by exposing the patient to anxiety-provoking stimuli. His methods begin with training programs that teach his patients to relax their muscles and their minds. While the patient is in a deeply relaxed state, he helps them extinguish their fears by having them imagine fearful situations. They do so in gradual steps, and that move from remote associations of the feared situation to eventually direct images of it. In the process of systematic desensitization, the therapist and client first identify the stimuli that provokes anxiety and arrange them in a hierarchy ranked from weakest to strongest. The client goes to the next stronger one. After a number of sessions, the client can imagine the most distressing situation on the list without anxiety, hence the term systematic desensitization. In some forms of systematic desensitization, it may be called exposure therapy. The therapist may actually have the patient confront the feared object or situation. So an example of exposure therapy could be like using virtual reality, like we see pictured below, where a person would see it and maybe reach out, perhaps try to expose themselves to it. That could also be maybe if a person fears flying, to perhaps kind of be in a simulator to kind of try to see it and then to kind of have that experience eventually. Aversion therapy. This is, as in classical conditioning, it's a procedure where averse counter conditioning involves presenting the individuals with an attractive stimulus paired with an unpleasant or aversive stimulation in order to condition the revulsion. If you remember back to John Garcia and his experiment that he did with coyotes and sheep, this is kind of on that line. So this type of therapy helps people who are attracted to harmful stimuli like drugs or sexual attractions or violence. Another way of dealing with this is like electrical shocks or a nausea-producing drug whose effects are highly unpleasant but not themselves dangerous to the client. The negative reaction, which would be the unconditioned responses associated with the aversive stimuli, come to be associated with the conditioned stimuli, such as an addictive drug. And the person develops an aversion that replaces the desire. So it would be like for the example here, you're exposed to the foul smell. You might eventually smell cigarette smoke, and then eventually it kind of causes a nausea. And so at some point in time, the unconditioned stimulus will be removed, and cigarette smoke in itself will cause the conditioned response of nausea. Operant conditioning therapies. Many behavior problems found in both children and adults have been shaped by rewards and punishment. Examples of this would be contingency management, which is an operant conditioning approach to changing behavior by altering the consequences, especially rewards and punishments of the behavior. So, for example, Johnny's parents may learn to extinguish his fits at the grocery store by simply withdrawing their attention. Instead of, they try to catch Johnny being good and give him the attention that he needs, tying the rewards closely to the desired behavior. Sometimes token economies, which is also an operant technique, can be applied to groups, such as a classroom or a mental hospital ward, involving the distribution of tokens or other indicators of reinforcement contingent on the desired behavior. The tokens can later be exchanged for things like privileges, food, or other reinforcers. This is used to encourage pro-social behaviors among mental patients or prisoners or even elementary students. Participant modeling, which is an observational learning therapy, learning a behavior by observation and imitation. This kind of goes back to Albert Bandura and some of his teachings on observational learning, but participant modeling, this is a type of social learning technique in which the therapist demonstrates and encourages the client to imitate a desired behavior. This is used to teach athletes new skills. There's symbolic modeling. It's a technique in which subjects receive indirect exposure by watching film or video in which models deal with a feared situation. Desensitization therapy, which we kind of talked a little bit about, this involves exposures to an imagined fearful stimuli. No therapeutic intervention. So for the most part, the controlled condition is what we're referring to in that. Thank you very much.